Hello, today I'm going to talk to you about DRSABCD, the action plan. This presentation is designed to talk you through what we're going to do in class when we practice our DRSABCD response in our CPR unit. You'll be asked to think about some things along the way and bring those answers to class with you when you come. So let's get started. D is for danger. You are never expected to put yourself in danger to help somebody else. So make sure you have a good look around for danger to yourself, the patient, and to other people. Some things you could look for might be sources of electricity, waves and water, maybe rocks and dangerous locations. Think about some other dangers that you can think of and write or draw one on the screen. So R stands for response. To check a person's response, we do this by doing what we call talk and touch. You need to get down low, speak into both the person's ears, and touch both sides of their body. Have a think about why we might need to do this on both sides. To help us check for a response, we can remember cows, not the kind in the paddock chewing on grass, but an acronym that can help us ask the right questions. Can you hear me? Open your eyes. What's your name? And squeeze my hand if you can hear me. Drag and drop the question to the right spot in the acronym. S stands for send. Send for help right away. Grab a phone, call 000 and ask for the ambulance. Tell them clearly where you are. If you're in a remote area, remember you can dial 112 from your mobile phone. It's best to get another person to do this. Have a think about why this might be. A stands for airway. We need to have a good look inside the person's mouth without moving them off their back and make sure there's nothing blocking their throat. To do this, you have to get your hand in there and clean it out if there is. Sounds gross, I know, but you could be saving someone's life. So B is for breathing. We need to check if a person is breathing normally. To do this, we need to get down low and look, listen, and feel. We need to look for chest rise. We need to listen for breathing and feel for breath with our hand or with our cheek against the person's mouth. So C is for, obviously, CPR, or cardiopulmonary resuscitation. We're going to be practicing this a lot in class, but before we do, there's a few things you can know. The first one is you need to be able to find the middle of a person's chest and you need to push down hard. You need to be able to push down about 1/3 of the depth of that person's chest. You need to remember to do this 30 times and then give the person 2 breaths. So 30 to 2, 30 compressions and 2 breaths. You should be able to do this about 5 times in 2 minutes. It's important to remember that once you start doing CPR, you can't stop until someone qualified comes along to relieve you or unless you are too exhausted to continue. Finally, D is for defibrillation, which is basically shocking the heart of a person who has an abnormal heart rhythm. We do this using a machine called an AED, or an automated external defibrillator. Most places have them these days, and just about anybody can use them. They look a little something like this, and they give you instructions on how to use them and talk you through what to do. So you don't need to be afraid to give it a go. If a person needs defibrillation, the sooner they get it, the better. Have a go at rearranging these letters into the right places in the acronym. If you can do this, you understand the steps and maybe you could save a life. In class, we'll be doing lots of practice, and then you'll be making a video to show other students how they can use the DRSABCD action plan. Press play on the video link in the next slide so that you can have a look at what your video might look like.